Good morning, everyone. Welcome to our session this morning. We're really happy so many of you could join us today. I'm Charlotte Stevenson. I'm a business development manager in the university, and it's our role to support any kind of CPD activity run by Cardiff University. A few quick bits of housekeeping before we get going this morning. We've got the chat function available if you want to talk to the team. If you've got any sound problems or any technical issues, pop it in there and one of us can get back to you. And we've also got the Q&A. I'd really encourage you to pop any questions you've got for Samantha this morning in the Q&A. And we've budgeted a bit of time after Sam's presentation to ask her those questions. So pop them all in there and we'll make sure they get answered. And we're all working in different locations, so please bear with us if there's any interruptions, sound issues, comedy talking on mute, anything like that. Enough from me. I'd like to hand over to Samantha Holloway. Sam's a reader in the School of Medicine and also Programme Director for Wound Healing and Tissue Repair. Over to you, Sam.
Thank you very much, Charlotte. So just as a starting point to check that you can see my screen okay, I'm sure I'll get a nod from the team if you can't.
Yeah, all good, Sam.
Thank you. So hello, it's a pleasure to welcome you to the Cardiff University Spring Continuing Professional Development Programme, and in particular to my session, which addresses the importance of maintaining and promoting skin health. As Charlotte said, my name is Samantha Holloway, and I'm a reader in the Centre for Medical Education, which is based in the School of Medicine in Cardiff University. It's great to see so many of you attending. I look forward to answering any questions you may have at the end of the session. So as Charlotte said, please post your questions in the Q&A box. So this is what I plan to cover in this session. We're going to look at the importance of skin as an organ, as well as discussing the anatomy and functions of the skin. We're going to talk about the role of the epidermis in maintaining homeostasis, as well as thinking about some factors that affect skin health and integrity. I'm going to focus a little bit on skin changes associated with aging, as it's something that's happening to all of us, as well as strategies to reduce the risk of skin damage. And also to get you to think about the role of education and self-care in the maintenance of healthy skin. So the skin is a multifunctional and complex organ that provides the human with critical physiological and homeostatic mechanisms that ensure survival. It is the largest organ of the body and accounts for 15% of body weight. The primary function of healthy skin is to act as a barrier against chemical, physical, and mechanical hazards, as well as invasion from microorganisms and allergens. In healthy individuals, the skin is strong and resilient and has a remarkable capacity for repair. Human skin is composed of two distinct layers, the epidermis, which is the outermost layer, and the dermis, the second layer. Beneath that lies the subcutaneous layer. The epidermis is the thin outer layer of the skin and consists of 5 layers. It repairs and regenerates itself approximately every 4 to 6 weeks. The dermis sits below the epidermis and consists of two layers, the papillary dermis and reticular dermis, which is composed of collagen, reticulum, and elastin fibers. It also contains a network of nerve endings, blood vessels, lymphatics, capillaries, sweat and sebaceous glands, as well as hair follicles. The subcutaneous tissue, sometimes referred to as the hypodermis, is composed of adipose and connective tissue, essentially the fat tissue. It contains major blood vessels, nerves, and lymphatic vessels. It acts as a mechanical shock absorber, amongst other things. The histology slide on the bottom right really shows the intricacy of the layers of the skin and helps to visualize the structure of the tissues. So in healthy skin, it performs a number of functions, including protection. So it acts as a barrier, preventing damage to internal tissues from trauma, ultraviolet light, as well as toxins, pathogens, and allergens. It also acts as a barrier to infection. In addition to providing a physical barrier of intact skin, the presence of sebum, which is a natural antibiotic chemical in the epidermis, as well as preserved surface acidic environment, also helps prevent from infection. The epidermis also helps with sensory perception as it contains nerve endings within the skin to respond to stimuli such as tissue injury, which causes pain, temperature, vibration, touch, and itch. The skin also has a role in temperature regulation, enabling either heat insulation or cooling of the body. Production of vitamin D in response to sunlight is important for calcium homeostasis and in developing and maintaining bone mass. And then also the production of melanin, and this is responsible for skin coloring and protection from sunlight radiation damage. In addition, the skin's outer appearance and capacity for sensation are important factors for well-being, self-esteem, cosmetic attractiveness, and communication. Skin also facilitates communication through touch and physical appearance, providing clues to the individual state of physical well-being. The outer epidermal layer is a barrier, as I've mentioned. It prevents the evaporation of water from the body and absorption of water from the outside environment. The epidermis is divided into 5 layers as shown. The stratum basale at the bottom is the germinating layer, and this contains the main cell type known as the keratinocyte, which may be dividing or non-dividing. The basal cells then move upwards towards the surface and form a layer known as the stratum spinosum, or the spiny layer. In here you'll find Langerhans cells, which are important for immune function. Keratinocytes in the stratum granulosum, or the granular layer, contain a substance that plays an important role in the barrier function of the skin. The stratum lucidium, or the glassy layer, sits between this layer, but only is found in the palms of the hands and soles of the feet. And finally, the stratum corneum, or the horny layer, is comprised of dead cells, essentially, that have migrated from the granulosum layer. The time from cell division to shedding is around 28 days, but may extend for a further 2 weeks. So at this point, we're going to get some audience participation, and I'm going to ask you a question. So if we can launch the first poll, please. So which layer of the epidermis provides the majority of the barrier function of the skin? So I'll give you a minute or so to answer that question. So hopefully we've got some responses coming in, so we'll give it a few more seconds before closing the poll. So thank you. We'll probably take a look at the results now.
Jess, are you able to reveal the results of the poll?
Yeah, they're being shared right now. Can you see them?
No, it's not showing.
Sorry, no, I'm
Okay. Do you want me to talk you through them? Because so the most popular option is the third choice. 45% of our attendees have chosen the third option, and then the next one is 32%, which is the first option.
Okay, thank you. So well done to the 45%. Stratum corneum is the right answer. Thank you. Oops, sorry. Okay, so moving on, let's think about the barrier function of the stratum corneum a little bit more. At the stratum granulosum stratum corneum interface, lamellular granules, which have a role in keratinization and maintaining the barrier function of the skin, join with the cell membrane and discharge their content into the intercellular lamella. Complex enzymatic reactions lead to modifications of the lipid composition of the intracellular space, which contain cholesterol, ceramides, and free fatty acids. And these provide a very effective water permeable barrier. Removal of the ceramide component by repeated washing with detergents and soaps can lead to conditions such as chronic irritant contact dermatitis. Transepidermal water loss is the rate at which water vapor is lost from the skin. In a healthy state, the epidermis can resist the assault of external irritants to protect the skin integrity. However, in the presence of continued external irritants, damage to the skin barrier occurs, leading to water loss from both the dermis and the epidermis. The consequences of repeated assault leads to loss of water from both the dermis and epidermis, leading to dryness. Therefore, it is important to maintain the protective acid mantle and skin lipids to reduce risk of dryness and damage. The optimum pH of the skin is 4.5 to 6.5 to protect that acid mantle, the purpose of which is to shield the epidermis from bacteria and pollutants. It also helps to regulate the skin's natural sebum and water balance. This mantle is comprised of perspiration as well as oil from the sebaceous glands. A higher pH, i.e. a more alkaline environment, breaks down this protective mantle, allowing bacteria and external irritants to enter the tissues. So we're going to launch the next poll now to ask you, what is the normal pH range of the acid mantle of the skin? So I'll rely on my administrative support to let me know when we've had sufficient responses in. And if I can't see the poll, perhaps you can just let me know where the majority of responses lie. Lovely, I can see that, that's great. Brilliant, okay, 81%, everybody who's listening, that's brilliant. It's right, 4.5 to 6.5 is the normal pH. So we're going to think now about the summary of factors affecting skin health. And there are a number of factors that can lead to the skin becoming vulnerable and at risk. For example, age is a major factor, as is ultraviolet radiation damage. There are also some genetic conditions such as ichthyosis, which can lead to dry skin. Some medications and irritants, for example, in creams, as well as too much moisture from sweating or incontinence, can affect skin resilience. Finally, repeated skin cleansing and washing can deplete the natural moisturizers in the skin and lead to breakdown of the acid mantle, the importance of which we've already talked about. And also on this slide, you'll see a number of other factors affecting skin health are important to think about, particularly nutrition and hydration, which we'll come back to, as well as if a patient's in hospital, whether they have a fever, infection, and also fecal or urinary incontinence is also an important area. So these are a summary of factors we need to think about. But what happens in the older adults? Well, I've mentioned that age is one of the main factors that affects skin health. The normal aging process causes changes in the skin that make it more fragile and susceptible to damage due to thinning of the epidermis, as well as loss of collagen and elastin and overall loss of moisture. The amount of subcutaneous fat decreases and the skin cells associated with immune function reduce. The most visible feature of older skin is perhaps wrinkles, which is shown in the picture on the bottom right. This is the visual sign of the changes described previously and means that the skin is much more at risk of damage from minor trauma, such as knocking the arm on a chair or on a doorway or a shopping trolley or getting on and off transport. That skin is very easily damaged. In the previous slide, I described the features of skin atrophy or skin weakness that occur as part of the normal aging process. Other factors that may contribute to skin frailty include a number of other things which I'm going to explain. So ecchymosis. This is the medical common term for bruises. It describes skin discoloration that results from bleeding underneath the skin and is usually larger than 1 centimetre or 0.4 inches. Senile purpura is a common benign condition characterised by the recurrent formation of purple ecchymosis or bruises. And these are often seen on the extensive surfaces of forearms following minor trauma. A hematoma is also defined as a bruise or collection of blood in the tissues. These are usually dark red, black, and form a collection of blood standing proud of the skin. So they differ to bruises in that sense. Stellate pseudoscars represent a disorder of the senile skin or older skin, and are confined to the back of the hand and the radial and extensor aspects of the forearm. The clinical appearance is that of multiple, whitish, slightly depressed, irregular shaped, frequently linear or star-shaped areas in atrophic and irregularly pigmented skin. Episodes of senile purpura away from the pseudoscars are common, and that's shown in the picture in the bottom right. And then also something we all need to be aware of is photo or UV radiation or sun damage. Photoaging refers to skin damage caused by prolonged skin exposure, specifically UVA and UVB rays, and this can lead to skin cancers. Most of the skin changes that occur as we age are accelerated by sun exposure. These changes are irreversible but can be mitigated with good skin health approaches. In terms of risk factors for skin damage, the most common risk factor is itching or pruritus, and this is defined as an unpleasant sensation that elicits the desire to scratch. Itch is the most common skin disorder in the elderly, and while often ignored, can have a major impact on the quality of life in older patients. The high prevalence of pruritus in the geriatric population has been partially attributed to the decline in the normal physiology of the advanced aging skin. Major changes in skin structure and its ability to regenerate, along with cumulative effects of the environment, diminish the barrier function and hydration status of the skin. These changes make the elderly more susceptible to entry of irritants and allergens through the skin, leading to inflammation and pruritus or itching. So it's essential to break this itch-scratch cycle with appropriate management, for example, by using moisturizers. So it's really important to undertake a comprehensive skin assessment, and this should take into consideration the overall picture of individuals. For example, their mobility, their nutritional status, socioeconomic, as well as psychosocial factors. A full holistic skin assessment should be conducted at the first visit or on admission to the clinical setting. An ongoing inspection of the skin should be incorporated into an integrated and documented daily care regimen. And this is to ensure any changes in the individual's health or skin status are identified. And it's important to note that clear, consistent, and accurate documentation is a key part of this. So see, these are some of the aspects to think about that are listed here. And these can be easily translated into some sort of checklist in order to provide some sort of documentation. If an individual is deemed to be at risk, the risk reduction program checklist shown here in this table should be implemented. Whilst this checklist is specifically targeted at individuals who are at risk of skin tears, as you'll see there from the first point on the table, the checklist and principles apply to anyone with vulnerable skin. We should look at the individual's overall medical and skin-specific history. So we're considering there whether there are any existing skin conditions, any history of skin issues, or past skin damage. And this is an important element of assessment, and action should be taken accordingly. Other factors should also be considered when caring for at-risk skin, such as reducing sun exposure, minimizing frequency of bathing, taking care that water temperature is not too hot, and patting the skin dry with a soft towel rather than rubbing. The use of suitable products should be incorporated into a standard approach to skincare to aid with moisture management. And using liquid body wash instead of soap for cleansing can help protect and hydrate vulnerable skin at risk from damage. In addition to the skin-related factors, an individual's mobility and general health should also be considered. There are a number of actions that can be taken to reduce the risk of skin injury to the skin related to mobility. For example, we can encourage the individual to be active and undertake exercises so that their physical function isn't impaired. We need to avoid friction and shearing by moving and handling the patients very carefully. If the patient seems to be at risk of a fall, we need to undertake a falls risk assessment, as most of the damage to skin occurs through falls. Importantly, and maybe quite commonly, is ensuring that the patients or individuals wear sensible and comfortable shoes. Making sure that clothing and compression garments are carefully applied when helping patients change their clothes. And thinking about a safe environment, is there adequate lighting, removing obstacles? And as shown here in the picture, padding out furniture where there are sharp edges can also help to reduce the risk of skin damage. And also consider the risk from pets. Whilst we can't ask people to get rid of their pets, we just need to consider what risk they might pose to elderly patients with vulnerable skin. And in terms of general health, education is really important, both of the patient and carers and their family, making sure patients and individuals are actually actively involved in their care, thinking about optimizing nutrition and hydration, and where appropriate, referring to a dietitian for additional input. If patients have particular sensory perception issues such as diabetes, then they may need appropriate specialist referral. And we also need to consider the effects of multiple medications or lots of medication polypharmacy on the patient's skin, because there are a number of medications that can affect this. So before moving on to the next part of my talk, I want to ask you a question which I haven't actually covered the answer to yet, but let's see what you think. So if we can launch the poll. To think about how often should the skin be moisturized to maintain healthy skin. Is it once a week, every other day, every day, or twice a day? So if we're ready to launch the poll.
The poll's been launched, Sam.
Okay, it's just I couldn't see it, but that's fine.
We've got a few people answering that on the chat, so I'm not sure whether everybody can see the poll.
Okay, so I say I'm a little bit blind here because I can't see the poll, so.
Can you see the results now, Sam? I'm now
No,
sharing
I
the
can't.
results. No? Okay, so most 46% have responded every day, and then 38% have responded twice a day.
Okay, we'll come back to that when I've gone on to my next slide then. Thank you for taking part. So regular moisturising should be viewed as a vital part of skincare in individuals with frail skin in order to promote general skin health and reduce the risk of skin damage. This can help to restore the barrier function of the skin, reducing itching and increase the level of hydration of the skin. The benefits of moisturising to treat specific skin conditions are well recognised, but in patients at risk of skin breakdown, they should also be used as part of a full everyday skincare routine. The use of moisturisers has been found to aid prevention of forms of skin damage, including skin tears and superficial pressure ulcers. For example, a study in Australia evaluated the effectiveness of a twice-daily moisturising regimen as compared to usual skincare for reducing skin tear incidence in older individuals. The study found that the application of a pH-neutral, perfume-free moisturiser on the extremities applied twice daily reduced incidence of skin tears by almost 50%. So for those of you who said twice daily, well done. So these are some of the key aspects to think about in maintaining and promoting skin health. And the key thing is to involve everybody. So I've already mentioned the importance of involving the patient themselves or the individual, as well as their relatives and carers. And then thinking about the environment of care. Is it a social care setting, perhaps residential care, and making sure that everybody's involved in thinking about skin health? Role of nurses is important in terms of primary and secondary care, as well as working in long-term care. And we shouldn't ignore the role of healthcare support workers and allied professionals as well in promoting skin health. So that will include doctors, physiotherapists, occupational therapists, dietitians. There may be others, it's not an exhaustive list. But I think the key thing here I'm trying to convey is that skin health is everybody's business, and we should all be taking a part in maintaining that. So coming back to the role of patient education and how can that be delivered? Well, of course, we can give verbal information, but it's easy to forget, isn't it? I'm sure we've all been given information that we've completely forgotten within a few days or so. So I think we should be supporting verbal information with printed or online materials. The patient's health literacy also needs to be taken into account in order to ensure education is delivered in the most appropriate way. And it's important to support patient education with education of family and carers. So we need to think about perhaps referring to reputable internet sources, such as the British Association of Dermatologists. That's just one example. But then thinking about what does the patient need to know, but also what do they need to do? Because we need them involved with their care in order to ensure that there's shared decision-making to improve outcomes. And as I mentioned, it's also thinking about the involvement of family and carers. So I've presented to you there this notion of patient empowerment, patient engagement, and health literacy as three important features of patient education. So we need to think about assessing the individual's capacity and capability for being involved in their own care, as self-care for the skin can be a powerful tool as part of a skincare regimen. If family or carers are involved, they can also be educated in skincare and how they can help. In suitable individuals, moisturising can be incorporated into the individual's own daily routine. For example, they can be instructed to apply emollients or moisturisers themselves, or increase an existing moisturising routine, as well as optimising their bathing regimen to incorporate suitable skincare measures that would reduce the risk of damage. Involving the patient in their own care or the individual is the key to the success of any care routine. Patient choice and acceptability are particularly important in emollient product selection. It's important that a holistic view is taken on self-care, ensuring that the patient is as healthy as possible. Nutrition and hydration are key to skin health and can help to prevent skin damage. And mobility should also be encouraged wherever possible. So I've mentioned nutrition and hydration a number of times, and I just want to focus on a few of the vitamins that are involved or important in skin aging. So what we need is a balanced, healthy diet. That's essential for skin health. But just focusing on the role of vitamins for the moment, I've picked out a few here that are vital. So vitamin C is important for skin strength. It gives, it's important for collagen production, and we get that from fresh fruit and vegetables. Vitamin E is found in vegetables and vegetable oils, and this works along with vitamin C to help skin strength as well as promoting lipid production. Vitamin E derivatives, so the carotenoids, have a photoprotection role, and their main source is orange fruits and veg such as carrots, mango and sweet potatoes. And then finally vitamin D. This helps to regulate calcium in the body and helps with the immune response. But this requires safe sun exposure and also needs to be considered in terms of it's present in dietary enriched foods. So here I've presented to you a kind of self-care checklist for patients with vulnerable skin that can be easily used and easily translated into documentation in order to help the patient think about their own skin health. So this is encouraging the patients to monitor their skin health and their holistic well-being. And there's a list of 8 questions here that the patient can essentially use as reminders, or the carers can reuse as reminders to check the skin. So it's thinking about an individual skincare plan, the use of emollients. It says every day there, but ideally it should be twice a day. Thinking about whether people are drinking enough water and eating sensibly, and keeping active and mobile. Again, reflecting on whether they're wearing the most appropriate clothing to protect the skin, such as garments that have long sleeves, shin guards, or tubular bandages that might protect vulnerable areas such as the shin. I've mentioned before, but the environment, so adequate lighting, getting rid of obstacles and padding out furniture, as well as thinking about those sensible and comfortable shoes to avoid falls. So here I've listed my top 7 tips really that are important take-home messages that should be relatively simple to implement in practice. So skin hygiene, essentially keep it clean, dry it carefully and moisturise. Protect the skin from injury during routine care and create a safe environment, taking into consideration the equipment, clothing and falls precaution. Thinking about caregiver and patient considerations such as nails, are they kept short, and avoiding wearing jewellery to cause any skin damage. Ideally, avoiding the use of any adhesive products on the skin, so plasters and tape, because they can remove the outer layer of the skin and cause damage. Nutrition and hydration, I've mentioned a few times. And then also consider special risk for individuals who are both overweight because they have increased risk of moisture and sweating, which can cause an issue of skin breakdown, but also individuals who are underweight because they have poor tissue resilience. So earlier on, I talked about the importance of the fat layer being a shock absorber and protecting us. So when patients are underweight, they lose that natural shock absorbing ability. So in summary, in health, the skin is strong and resilient. The primary function of the epidermis is as a barrier to protect against external insults. So it's maintaining that barrier function and acid mantle of the skin is vital for skin integrity. So as healthcare professionals, we need to be cognizant of the factors affecting the skin in order to optimize skin health and integrity. And importantly, we do need to engage individuals with self-care measures to optimize their skin health. These are a list of sources that I've used in my talk if you wish to follow up on them. And then to keep updated and get involved, for further information on skin frailty and skin tears, please refer to the website for the International Skin Tear Advisory Panel, and that's skintears.org. You can also follow the panel on Twitter @SkinTears. And actually there's a global Skin Tears Summit taking place tomorrow for anyone wanting more information. So please visit the website address there if you want to sign up and register for a whole afternoon of activities related to skin frailty. So I'd like to finish by saying thank you very much, or diolch, for your time. I'm happy to take any questions you may have.
Thank you so much, Sam. I'm going to apologise in advance because my neighbour's having an extension. So if you hear the drilling, please excuse that. We've had a couple of questions already. So anybody who left on the call who'd like to pose a question, pop it into the chat or the Q&A and we'll make sure it's asked now. We've had a couple of questions about collagen. What are the best products or natural applications to help with collagen loss? And you did mention it, can taking collagen orally improve skin quality and resilience?
Yeah, some important points there. I'm very much an advocate of more natural ways of ensuring collagen is maintained. And collagen production relies on vitamin C, as I mentioned. So it comes back to having a balanced and healthy diet. I mean, yes, there are lots of products out there that talk about, enhancing collagen. But I think the important things are the diet, and moisturizing, because that will help to bolster the skin's natural resilience.
Thanks, Sam. What constitutes safe sun exposure, and does sunscreen block vitamin D production?
An interesting question. I would refer you to the British Association of Dermatologists, because they've got some really useful information there on healthy levels of sun exposure, and also the use of different levels of sun creams in terms of their ability to block the sun's harmful rays. I mean, I guess depending where you are in the world, here in Wales, we don't get a huge amount of sun, but we do need to be cognizant of it's not just, the sun being bright, shiny and out there and hot. It's also where there is no clouds and you can still get sun exposure. So I think refer carefully to the up-to-date requirements and recommendations from associations such as the BAD, and also choose sun creams carefully. And yes, there is a slight concern that the high factor sun creams can block some vitamin D, but I think, again, the chances are, depending where you are and the use of sun creams at the moment, that's probably less of a likelihood.
Advice for caring with an older person with pressure ulcers.
Okay, so if somebody has existing pressure ulcers, that means that their skin resilience, their tissue resilience is quite low. So vulnerable skin in itself does not lead to pressure damage. What would lead to that patient having a pressure ulcer is immobility, and they're unable to move. So what we want to do in caring for patients is make sure that we reposition them carefully. We don't position them on the area that there is a pressure ulcer on, but in order to prevent other skin breakdown, again, it's the importance of moisturizing the skin, careful handling of the patient as well to reduce the risk. But all those other things we talked about as well in terms of maintaining healthy skin and tissue resilience are important as well.
Thank you, Sam. Do you have any suggestions about vitiligo that's increasing rapidly post-menopause?
Oh gosh, that's not my area of a speciality. I'm not a dermatologist by background, so I would have to refer that question to the a dermatologist, I would say. So apologies that I can't answer that, but good question.
And how do you choose the right dressing for skin tears or wounds?
Oh, another very good questions. So if I can concentrate on skin tears for the moment, there are different types of skin tears, and if you refer to the website, the skintears.org website, it's a very nice summary there of choosing dressings depending on the type of skin tear. Essentially, what we want to try and avoid are any adhesive products. So a skin tear is where you've lost sort of the outermost layer of the skin by pulling off an adhesive dressing or some sort of plaster or tape. And we don't want to do that again. So what we want to do is use products that protect that area and don't increase any risk of harm. So that was for skin tears. For wounds, there are so many different types of wounds. It would be difficult for me to summarize all the different types of dressings for wounds, but perhaps I could point you to resources such as the Wounds UK website or the European Wound Management Association website. They have lots of resources about different types of wounds and how you go about choosing dressings, because for some patients, it's not just about wound management. They may require bandages, they may require other sorts of dressings and interventions in order to help wound healing.
Somebody's going to test my ability to read medical terminology now, because I feel like I'm back in primary school. I've somebody with a 6-year-old who has ichthyosis.
Ichthyosis.
Thank you. And it's gone worse over lockdown. What could be done to alleviate itching?
Okay, so I talked about this itch scratch cycle, and it's difficult to give specific advice to an individual. I would have hoped and thought maybe that the child is being seen by a dermatologist. I think ichthyosis is a genetic condition of dry skin. So it's importance about moisturizing, but I would say if it's got worse, I know it's difficult to access healthcare in the current pandemic situation we have, but I think the advice will always be, don't leave anything if it's got worse, seek advice on that, particularly in a child where we need to think about the appropriateness of different moisturizers and creams. So I would ask that person to contact their GP and seek advice soon.
Last one then, is there any support for families in relation to person manual handling and prevention of skin damage or tears?
Again, a really good question. I think, it's a question of working alongside the healthcare professionals and asking those questions about what can we do to minimize and prevent damage. Some of the things I mentioned there, very simple things about, keeping nails short, making sure there's no jewelry, thinking about how you handle patients with vulnerable skin, making sure that the patient's skin is covered, and that think of them as like a little peach. You know how you would handle a peach very gently because they bruise easily. I think it's, trying to think about how you can do that. But I would certainly be proactive and asking questions of the healthcare professionals to say, okay, outside of the time that the healthcare professionals are here caring for my relative, what can I be doing to minimize that? And some of those checklists can be really helpful in just reminding people about what to do and what not to do, really.
I'm going to squeeze one more in because somebody's just popped one in. Top tips for psoriasis.
Oh, lots of dermatology related questions. I probably should put a caveat at the front of my talk saying I'm not a registered dermatologist. I'm a nurse by background. So again, I would have to, and it feels like a bit of a cop-out, I know, but I would have to refer you to the British Association of Dermatologists, or also if it's somebody who's already seeing a dermatologist and the psoriasis has got worse, perhaps seeking further advice on how to manage that.
Fab. Thank you so much, Sam. I think that's all we've got time for. We had quite a few questions to get through there. It was a fantastic session. I know I've taken quite a few notes myself. Just for anybody left on the call, if they want any further information, you've got the MSc in wound healing and tissue repair and the standalone modules that are available, and they can contact you through Cardiff University or contact us via Twitter or our email address, and we can pop you in touch with Sam. Okay, thank you so much for your time, for everyone who joined in, and thank you so much for a fantastic session, Samantha.
Thank you, and goodbye, everybody. Thank you for taking part. Thank you.
Enjoy the day. Bye.